We have an interesting show for you today. I think we have resident life and home health. Stay with us. Good morning and welcome to Village in Motion. I'm Marcia Boyles, and I'm delighted this morning to begin our segment with Donna Epps, who is our Director of Resident Life. Donna, we're delighted to have you this morning, and I'm going to leave it to you to introduce your very interesting and important new guest.
Well, thank you very much, Marcia, and I am very pleased to introduce someone that we have been waiting for quite a long time. As you know, a few months ago, the Ancillary Services Department went through some changes. We closed our hospice program, and that left us with certified home health and home support. So rather than having an operations manager over each separate line of business, we've gone to a new model where we have a home care administrator who is responsible for both lines of business. And so I'm pleased to introduce VandenDries, who's been with us for exactly 1 week, and she is our brand new home care administrator.
All right, well, thanks, Donna, for that introduction, and welcome, Christine. We're delighted to have you. You've been here a whole week.
A whole week.
Where did you come from before, and tell us a bit about your background?
Sure. My family and I recently moved from the suburbs of Savannah, Georgia. I am actually originally from Springfield, Virginia.
Oh, you are?
I am.
So you're coming back home?
I am coming back home. We have lived in El Paso, Texas, Augusta, Georgia, and then the suburbs of Savannah before coming back here. And my background started at Virginia Hospital Center as an orthopedic nurse. And I've worked in lots of different levels of care and community settings, but most recently I was the clinical operations manager for Kindred at Home. It's a large national home care company, and we provide basic home health services, so not unfamiliar to the home health care setting.
Yes, for sure. Well, that would be an excellent background. That would be an excellent background. Is your husband military?
I am actually divorced, but yes, he is.
All
My
right.
ex-husband is, and we have 2 children that are 7 and 4.
7 and 4. All right. But that's why you're moved around a bit.
A little bit, yes. Yes.
All right. We hear that so often here with our staff that their spouses are military.
Yes.
Christine, all right. Where did you do your nursing training?
I went to Northern Virginia Community College for my nursing degree. I also was at George Mason University where I studied vocal performance before becoming a nurse.
Vocal performance? Oh, for heaven's sake. All right.
I thought I was going to be a Broadway star.
Well, and she can certainly do the players here. We have community theater here.
That's what I keep hearing.
Yes, and I've already introduced her to Lois Craft, who everyone knows has a wonderful voice as well. So she is primarily here in her home care administrative capacity, but we all like to get involved in the community in different ways. So people have already been learning about her other talents as well.
Well, if you can sing, can you dance as well?
No.
No.
Absolutely not.
All right, well, singing would suffice very nicely. Christine, what changes would you envision that you might be looking to make, if any? And that's a ticklish question to ask you after you've only been here a week. Now, you're home support and home health, and you might want to so that there's no confusion, tell people what the difference is between home health and home support.
Sure. Home health, certified Medicare home health, is for people who have either acute or long-term illnesses that they need some healthcare oversight in their home. It's for patients that are considered homebound under Medicare guidelines, and we provide things like wound care, medication management, disease education. If you were to go in the hospital and get pneumonia for the very first time and know nothing about how to take care of yourself afterwards, we can provide education and oversight. every visit with the home care team involves vital signs and an assessment of their medical needs, but we also provide physical and occupational and speech therapy in the home as well. And then for home support is a more non-medical.
Now that's all reimbursable.
That is under Medicare, yes ma'am.
Under Medicare. Okay, thank you.
Home support is not under anyone's insurance. That's usually a privately paid for or long-term care insurance paid for service. And it's generally an aide. There's a nurse involved in creating a plan of care for every resident that is under home support. And then aides come out and help with things like bathing if need be, light housekeeping, some cooking, just general things that people need when they're living alone and have a medical illness or just a decline in their function at home.
We often have folks who have an aide in for a couple of hours in the morning to just help them get bathed and dressed and kind of organized for the day. And it can be a huge help.
Right, and the good thing about our home support services is that many other companies require a 4-hour minimum, and we don't have that. We provide 1-hour services in a home, but we also provide 30-minute escort services, and we are
right. Is as short as 30 minutes?
Yes, we do, because there are some residents who just need to be escorted from their apartment to a venue on campus, to the dining room, to an activity. We also provide escort services in Garden Ridge for people who have to leave campus for an appointment.
Oh, all right. So they could go fetch a wheelchair and take somebody to an appointment here or something of that sort. All right, that is a terrific service. And these are the folks that wear green shirts that we see in the hallways.
Yes, and the shirt colors are going to be changing.
Oh no!
Well,
now that we've just gotten used to
the shirt styles. For home support, traditionally they have worn the green smocks, and those were our CNAs, and the blue smocks were worn by the companions, but now everyone is going to be transitioning into a beautiful blue polo shirt. So
I see.
That will be coming soon. It is sort of a royal blue, but you will definitely be able to distinguish our team as everyone always has.
All right. All right. Well, that sounds good. Christine, do you envision making any changes quickly, or will things remain pretty much the same? Donna, you answering can certainly chime in on this too.
I think that for a minimum of 6 weeks, you need to absorb everything around you and see how everyone works, what works well, what doesn't work well. And the changes that you make in the beginning are always small, things like better communication and coordination of care between the two agencies. We're all in the same office, so communication flows back and forth really well. I don't see any massive changes, but I'm very much looking forward to getting out into the community more and meeting more of the residents and getting out into some of the facilities outside of Green Spring where our residents go as patients so that we can coordinate care between those agencies and us. I think that's going to be the biggest thing in the beginning.
Oh, all right. Can you give us some examples of that kind of thing?
Sure. You have so many hospitals in the Washington, D.C. area, and depending on the medical need, it's not always a straight shot to Fairfax Hospital. Depending on your payer source, you may have to go to Fort Belvoir if you're military. So getting more of a presence at those hospitals where people have elective surgeries because their physician may be there. Virginia Hospital Center is a good example, Mount Vernon Hospital, and then the facility on base as well.
Okay.
And coordinating with them so that when our residents do go out there, we have an open line of communication so that we can make sure that they know about our services here at Green Spring and that they can come back and have sort of an all-in-one, model of care, living here and being cared for by our staff.
All right, that sounds like an important thing, and your military background certainly would help you facilitate that.
Yes, ma'am.
One of the things that I think we're all interested in knowing too is whether or not there are any ideas or plans to be assisting folks with disabilities of particular sorts, and I'm thinking things like low vision, for example, coming into the apartment and helping people adjust and adapt to low vision issues.
Well, we have a variety of services and collaborative efforts across campus, and our resident services coordinators also work hand in hand with our clinical teams across campus to support all of the needs of our residents. So I can't point out, low vision particularly because we work with so many of our residents and helping them to, maintain independence and providing them the support they need as long as they are in the independent living segment of our community. There are, folks with low vision. We have residents that may have some hearing challenges. We have a Parkinson's support group. So we have a variety of team members that work with those group and help to support their needs across campus. And as ancillary services, we certainly coordinate and collaborate with the residents if we are actually providing care on our service, but we also coordinate with the resident services coordinators and the medical center as well as with the resident groups that support those different areas.
Yes, Donna, I'm aware of that. And that having been said, however, I think often it would be helpful to have particular strategies and somebody with expertise, for example, an OT with expertise in low vision, and there are such folks, we just don't have them here. But I wondered if there was any thought of trying to increase that kind of availability. And I realize that you couldn't have probably a full-time low vision OT person here. But, is there some possibility of bringing such folks on, at least on a part-time basis or on a consulting basis?
Right.
Because there isn't anybody with that expertise on campus.
Well, that would be a collaborative discussion that we would probably have with the medical center as well, because we have to look at the needs of the entire community, including at Garden Ridge. So, so we can certainly add that to our dialogue and discussion going forward.
Yes, that would be helpful, and I'm using low vision just as an example.